In its first year since establishment, IRCAD Africa, a state-of-the-art surgical training and research center, has significantly enhanced the skills of Rwandan doctors, as confirmed by the Ministry of Health. This advancement is contributing to improved healthcare services for patients across the country and beyond. We have the details with Olive Nete.
In its first year of operation, IRCAD Africa has trained 382 doctors from 26 countries around the world through intensive 3 to 5 day surgical courses designed for practicing physicians. This year, the center also expanded its training to include nurses, recognizing their crucial role in surgical care. Dr. King Kayondo, president of IRCAD Africa, emphasized that offering these high-quality training programs to healthcare professionals globally is a significant step toward addressing existing gaps in the healthcare sector.
Nous avons pu faire plus de 15 cours.
We have been able to conduct more than 15 courses, and these are courses of a very high level. On the other hand, we are also conducting research on innovative projects. At this stage, we already have a very interesting project. We are working with our French colleagues on a revolutionary ultrasound probe. All these achievements are not just for the country. The benefits or the impact of IRCAD Africa's presence in Rwanda extend to the entire African continent. So far, more than 26 countries have sent their surgeons or nurses, not only from the continent of Africa but also from other countries across the world, like Pakistan and Afghanistan, who have sent nurses for training courses. I believe that IRCAD Africa is making an impact not only in Rwanda but also across the African continent.
IRCAD Africa est en train d'émettre, pas seulement au Rwanda, mais aussi sur le continent africain.
Dr. Claire Karitezi, a neurosurgeon who trained at IRCAD's center in France and now serves as IRCAD Africa's course co-director, highlights the impact of this specialized training. She notes that the skills gained through these courses enhance their expertise, enabling them to deliver faster and more effective surgical care to patients.
Usually mornings are dedicated to theoretical learning, so they are in the auditorium learning about the theory they are going to be practicing later in the laboratory room, and then in the afternoon we have, depending on which domain is being explored, so you may have pigs or some anatomical specimen. So you have maybe 1, 2, 3 days like that, and then you have evaluation every morning and at the end of the day, and an overall evaluation of the course. So of course, having such courses prepare surgeons to be ready before they can go and practice on patient or operate live patient in their own hospitals, because learning in a lab is the closest way to perform surgery in a better simulation scenario. So I'm a trained surgeon, but I still go to courses so I can master some of the new techniques or some advanced techniques. So it's very important for surgeons to do such trainings.
Rwanda aims to become a medical hub for Africa, providing accessible high-quality healthcare services to both Rwandans and patients from across the continent. The establishment of IRCAD Africa marks a significant step towards achieving this vision. Dr. Athanase Rukundo, the Director General of Clinical and Public Health Services at the Ministry of Health, emphasized the goal of training every surgeon at IRCAD Africa to boost the number of skilled professionals capable of delivering high-quality surgical services across the country.
Going forward, we want to make sure that our training programs, whether it's undergraduate, whether it's postgraduate, specialization in surgeries, we want to make sure that every trainees are passing here to be exposed to these tools, innovations, be part of this research, drive the future we want in this healthcare arena. And it's possible because we have the leadership that has made this possible. We hope that in the near future we'll be able to have almost everyone trained via settings like this one. It's not really only stopping here. We also want to make sure that, even the training institutions across the country have access to facilities like these ones.
The Lancet Global Health reports that 5 billion people lack adequate access to surgical services, resulting in 10 million deaths annually due to unmet surgical needs. To bridge this gap, an estimated 1.7 million additional surgical clinicians are urgently required worldwide. Olive Nete, RTV News.